um, so basically, this is so Import. Just to give you a brief background about who we are. Um, so so we've been working in the area of innovations, ICT-based innovations in the area of health, agriculture, and education, and so on. So one of our biggest kind of visions that technology can really decentralize the functions of experts. I mean, we have seen that in telemedicine, and we're basically trying to bring similar concepts of telemedicine in the field of agriculture also. So what I mean by decentralize the work of experts, I mean that there are, I mean, whenever you have field officers who are directly interfacing with beneficiaries, empowered with mobile phones, who can capture a problem that a beneficiary is facing and basically relaying that to an expert, the expert can get back with certain recommendations. So the expert does not necessarily have to be physically present in front of the beneficiary. And obviously, it's not going to solve all problems of the world. And it's a very much of an experimental phase where we're basically trying to figure out what are the kinds of recommendations, what are the kinds of circumstances that remote consultation is relevant and applicable. And it's also going to evolve over time, because I mean, what like we're seeing in health, that because the processing power of the mobile phone is also increasing very rapidly, the cost of a smartphone is also coming down rapidly. So which means that we can attach a lot of add-ons to these mobile phones, to these smartphones. Like for health, we can add on a lot of diagnostics applications. For agriculture, we can add on a lot of soil testing kind of equipment. So I mean, the whole scenario of remote consultation and decentralization of expert function is going to change and evolve over the years. So I think we are at a very nascent stage in this space. So I mean, I'll basically qualify by saying that a lot of what we're doing is at a very childlike, and we're only taking baby steps to figure out what are the possibilities that are out there. So in the area of livestock, I mean, obviously we have one of the highest cattle densities in the world. And then about 45% of rural households are heavily dependent on that livestock. And then the biggest problem that we have is that in the entire country of Bangladesh, I mean, we have only 4,200 registered veterinarians, which is basically that one veterinarian is supposed to cover more than 6,000 cattle, which is physically absolutely impossible to do. And then there are lots of remote areas which are not covered by any veterinarians at all. Like even the Department of Livestock, I mean, they have very few. Most of these registered veterinarians are actually private players. So the government is not really able to provide a lot of veterinary support themselves. So essentially, this gap is being filled by what are called livestock workers or para-veterinarians, who directly interface with beneficiaries, and they have, I mean, their skill level is extremely varying. I mean, some are good, some are bad, some just fill in, some are not even fully employed. So that is the gap how that's being filled. So the big challenges that we have in livestock services, one is the scarcity of practicing veterinarians. Marginalized farmers cannot afford expert service. So even if they can make a phone call to a veterinarian, because I mean with health you can actually take people to a clinic. With cattle you don't really have that option. So bringing a veterinarian to your home is actually a very expensive proposition. And then improper record keeping is also another big problem. Then expert advice is during emergency services. So these are essentially the problems that we are trying to address. Hopefully, let me see if let's see. So this is how the thing works. Oops. See, the sound is not working.
Workers as intermediaries. The livestock management system is an ICT-based tool to connect livestock professionals to smallholder farmers of rural Bangladesh through livestock workers as intermediaries. Livestock farming is one of the most important livelihood options for rural families in Bangladesh. Unfortunately, the sector faces a number of challenges such as scarcity of veterinarians, affordability of in-house veterinary services by poor farmers, record keeping of livestock husbandry procedures, and expert advice during emergency situations. The livestock management system is created to address and become the primary solution to these challenges with the use of a smartphone-based application. Let's see how the system works. Livestock workers register farmers and their cattle using the mobile application. On successful registration, the system gives a unique ID for the farmer and the livestock. The livestock worker makes scheduled visits every month to all the registered farmers to collect and send follow-up data focusing on cattle husbandry issues. In cases of cattle sickness, he goes to the household immediately, captures relevant cattle health information on the mobile application, and sends it to expert veterinarians. The expert veterinarian, having access to the livestock management dashboard, can give advice or prescriptions. The livestock worker receives the advice or prescription on his mobile application instantaneously and can act accordingly. This results in one veterinarian being able to provide services to many livestock farmers, a poor farmer being able to afford expert services at low cost. Records are digitized and can be accessed and updated from anywhere. All of this leads to the overall improvement of quality of livestock services and ensures food security.
Right. So as I was, sorry. So as I was saying before, I mean, we are, essentially taking baby steps to figure out, different price points, willingness to pay issues, how the entire business model will work. So right now we have about 24 livestock workers, and a number of them actually came to us to subscribe to this service. So they already had a smartphone and they wanted to subscribe. So we are right now at an experimental phase to figure out, we are not really charging these livestock workers yet. So because these livestock workers already have a mechanism of getting payments for their service. So what we're trying to do is increase their existing income, or we're trying to get more unemployed youth in the rural communities to come and work as paravets. So the price points are something that we're still kind of experimenting with. But we do have a model that we're trying to work out. One livestock worker essentially covers about 200 cattle per month. I mean, that's the general figure. So they right now earn about $1.3 per cattle, and then so 10 livestock workers. I mean, so the $1.3 per cattle, meaning that if they can serve about 200 cattle per month, they earn about $260 per month. And what we are assuming is that if they share about 25% of that income with us, then we have just about a kind of a break-even scenario. So the assumption here is that one veterinarian sitting in our office will be able to serve about 10 of these paravets. And this number may increase over time. So all of these are experimental, and we're trying to figure out, a lot of open questions that we're still trying to respond to as we go forward. So that's the basic sort of a very rough business model. So the operational costs are the veterinarian salary support, the training, marketing, and then we are discounting the cost of actually developing the application, because that will add to the cost. We're trying to sort of go for an operational break even. So that's basically the goal right now. Thank you. Open to questions.
So I think we'll start with the panel first, and then we'll go to the audience for all three presenters on the questions that they have. So, for the
how many livestock farmers are you covering?
Right now we are covering about 24. So here, so 24 livestock workers are using the service right now.
Farmer, how many do those cover? How many farmers?
About
do those cover?
27.
How many animals?
2,700. Yes.
And the animals are also 2,700, but they could be more. Animals could be more.
No, animals are 2,700.
Animals are
2,700 cattle. So the number of farmers would be less, because some of these farmers are, they have a small farm.
Okay. And for how long have you been operating?
For about six to 6 to 7 months, I think. So we are still very new. Yeah.
So, Mridul, just want to check, I mean, do they do a RFID tagging of the cattle, because just to kind of identify which cattle it is, and
Right,
so that
right. That we are not doing yet, but that's something that very large farms in Bangladesh have that. So the large farms have not subscribed to our service yet.
Sure.
But once they do, I mean, we can take advantage of that. So that's not a commonplace thing.
You're expecting the large firms to subscribe to your service?
We are, because the large firms also have the same problem. I mean, they don't have a lot of veterinarians. I mean, they often employ veterinarian, but they have very high turnover. And often they want a second opinion. So we are expecting. So we are trying to create a package for the large farms to subscribe to our services.
So, the other question which I would have is that, I mean, there is, I think, in this case, maybe given that, I mean, India also has a very large cattle population, and that we have an extension arm. I'm sure that some of these problems are common here.
Right.
And have you kind of tried to look at, what is being done in India? Maybe there are some learnings that you can kind of take to Bangladesh. And of course, I mean, this seems very innovative, and maybe there's some way you can cross-pollinate ideas, and maybe this could be kind of replicated in India. So
Sure. I mean,
just
there are
looking at
similar.
both way
Absolutely.
synergies.
Can I just add to this question? Actually, there's some very decent work in Pakistan that has been happening on livestock.
Okay.
That might be something that you want to consider. And I don't think there is much happening in India. India can actually learn from both Pakistan and Bangladesh on livestock.
Right. Yep. And I'll more information
You
about it.
propose to restrict yourself to only cattle, or do you have intentions to get into other veterinary products also, other veterinary animals?
We do.
You
But
do.
I mean, cattle is something that seems more of a lower hanging fruit than others, because I mean, with poultry, I mean, we actually tried poultry a little bit also, but the problem with poultry is that if there is a disease outbreak, there is very little time to do anything. So the expert service, I mean,
Has to be immediately
has to be
available.
immediate, and that is not what you can often have. I mean, with cattle, I mean, the thing is that when they go sick, I mean, they give you certain time, and the other good thing is that there is a finite number of prescriptions that you can provide. So that is why we started with this, but we definitely want to expand out to other veterinary services.
The time is still less than for crops.
Yes,
The time that you have.
right, exactly,
Still
crops,
haven't
yeah,
really got that.
right.
I think I personally would like to say that this is something which is excellent. I mean, in the work which, and it gives me some thought process which I would not like to disclose here. Thank you.
So I think we'll open the forum for all the questions for all the presenters out there. So I would request we have 5 minutes for all the questions that you have. So I would request the presenters to come here, and then the audience can ask them any questions that you wish to ask. And please take the name of the presenter that you wish to ask questions from.
What is the training required for a livestock worker?
So Mridul, there's a question for you.
Sorry. What is the training required for this? What is the training required for this livestock worker? So the livestock workers that we have been working with are already, I mean, they have worked as a livestock worker before. So we have not been involved in the training of livestock workers as such. But I mean, as I was telling you earlier, so I mean, our aim is to get a lot of unemployed youth kind of engaged in this. So we are developing a kind of a 1-week curriculum to identify the kinds of things that go wrong with a cow. I mean, there are certain things that you have to know. I mean, the cattle health. I mean, there are certain indexes. So the whole point is that part of what I was saying, that decentralizing expert services means that you have to be able to create an intermediary out of anybody within a few days of training. So that is the only way we can decentralize services in a highly populated country such as ours. Because at the end of the day, they are not taking the recommendations. All we need to train them up is to gather the right information. So it's much less risky.